Republicans are vowing to repeal Obamacare. Senator John Barrasso says the health care law is unworkable, unaffordable, and unpopular. Senator Barrasso is also an orthopedic surgeon. Why does he think President Obama's law is bad medicine for patients, doctors, and taxpayers? We spoke with Senator Barrasso about the health care law. Senator, nice to see you, sir.
Thanks for having me.
You were in the courtroom, sir, when the announced decision by the Supreme Court on the health care. I'm curious, what was it like?
Well, actually, no sound was made, no gasps, no applaud, nothing. It was just as if they were just reading. But so now it may not be unconstitutional, but the health care law to me is still, unworkable, unaffordable, and still very unpopular.
All right. Now, there are two ways I assume you look at it. One as a United States Senator, and the other as a practicing doctor. Let me go first to practicing doctor. What does this health care decision mean to the patient and to the doctor?
Well, it actually puts a government bureaucrat between a patient and a doctor, and nobody should be between a patient and a doctor. I think this is a law that's going to be bad for patients, as it has been, bad for the nurses and doctors who take care of them, and terrible for taxpayers because, as the justices said, it is a tax.
Well, explain to me, if I came in to you as an orthopedic surgeon, and let's say I have a sore shoulder, how would I notice a difference if I had insurance before and if I'm now in if let's say that I go into some other program?
Well, reimbursement for taking care of you under these programs is less. There's something called the Independent Payment Advisory Board that's going to determine what the government chooses to pay for different procedures. The amount of paperwork that's being done is increased. The number of forms that need to be filled out is increased. Doctors probably going to have less time to spend with you as they try to see more and more patients because of more people that have insurance coverage as a result of it who are trying to get into the offices.
But isn't that true already that doctors are now under a lot of pressure, have a lot of paperwork, whether it's to fill out for Medicaid or even with insurance companies, and you've got insurance companies breathing down your throat not to spend too much time. I mean, don't you already have that with the existing system?
Well, I think it's been a big problem. I noticed that in my years of practice, as you do spend more and more time on paperwork and on worrying about defensive medicine and practicing to avoid the lawsuit abuse that occurs out there, that you're spending more time on things other than time with the patient. And patients, want and deserve more of the doctor's time, and that time is less and less available.
I realize that this health care bill was driven and supported by the Democrats, but I'm curious, in the crafting of it, or even in terms of figuring out what's in it, do you know how much consultation there was, not with politicians or legislators, but with doctors who deal with patients every day?
I think there was very little with doctors that deal with patients every day, because right now practicing doctors around the country, you hear the numbers of 70 or 80% that are opposed to this health care law. And a lot of the reasons that so many of citizens around the country are opposed to it is that they've talked to a doctor or a nurse or somebody that's been impacted by the law. And some of the polling shows that people that have actually talked to a doctor, well, it's even more unpopular with those individuals than just the general population, but it continues to be very unpopular, even though it may be constitutional.
Do you agree the system at least now needs, I know you don't like the health care bill, but the existing system we have, or even before the health care bill, that it need to be fixed?
Oh, absolutely. The system that we had was not perfect. Actually, one of the reasons, Greta, that I ran for the United States Senate was because I knew things could have been better. And I think they still can be better, but this health care law isn't the solution. This is a health care law that's going to cause costs to go up. It's going to be lost control for patients and fewer choices for patients. So, that's not what people wanted. People wanted health care reform, and what they were looking for was the care they need from a doctor that they choose, not that the government chooses or an insurance company chooses, and at lower cost. And the president promised lower costs. But what we've seen is actually costs have gone up faster than if the health care law had never been passed in the first place.
Give me an idea of 3 things you would have done differently.
Well, I think from day one we could have accomplished so many things that would have worked actually to lower the cost of care if the Democrats would have been willing to work with us. One is, I think people ought to be able to shop around and buy insurance that works best for them from other states, so buy insurance across state lines.
Don't we have that now with these exchanges?
Well, each state is supposed to set up its own exchange. We don't have that now, but that's what I would have done on day one. To avoid all of these long fights and court cases, we could have done that right from the beginning. There's still no dealing with lawsuit abuse in here. Remember Howard Dean, who is chairman of the Democratic National Committee, when he was asked about this, he said, "Oh, we left that out because of the strength of the trial lawyers as financial contributors to the Democrat Party, so they chose not to include anything that really dealt with the incredible amount of defensive medicine that doctors practice, ordering so many expensive tests, more to treat the doctor than the patient." And I think anybody that buys insurance personally ought to not be discriminated against from a tax standpoint. They ought to get the same tax breaks that people that get their insurance through work have.